Now on Bounce. Recently, the American Heart Association and American College of Cardiology introduced new blood pressure guidelines for all Americans. So here today during Heart Month is Minute Clinic nurse practitioner Nicki Gatton. She's here to share with us 5 things we need to know about the new blood pressure standards. Nicki, thanks for being with us. First, why the change in the new guidelines?
A lot of the new guidelines were put into place just because a lot of people haven't been aware of their numbers, and so the new guidelines are a little lower than what a lot of people are accustomed to, but having those blood pressure guidelines in place, it really helps people to be more healthy at the end of the day.
Now, I asked you this off camera, but I know a lot of people are wondering, is this a way for the pharmaceuticals to make money? That here we were last year, I may not have had high blood pressure. Right. This year you changed the numbers, and now you're forcing me to buy medication to get on medication. And tell us about that.
Well, and that's actually one of the components of with the blood pressure guidelines. What we want people to do is to come in earlier. We're going to look at their blood pressure. We're going to identify the hypertension, the early hypertension. And when your blood pressure is elevated, we're going to talk to you about things like looking at your nutrition, decreasing sodium in the diet, making sure that you are exercising, looking at alcohol, or looking at things like smoking, talking about smoking cessation, lifestyle factors that we can hopefully lower your blood pressure, and then you can avoid the medication.
Yeah, you talked about those lifestyle changes. Now, I guess the new definition of the normal blood pressure, what is the definition of the new normal blood pressure?
It's 120/80 or lower.
Wow. 120/80 or lower.
Correct.
Okay then. All right then. So the second point has to do with elevated blood pressures and lifestyle changes. So hypertension now begins at what level?
When a person's blood pressure is at the 130/80 to 89, that's when we say that they have the stage 1 hypertension.
Okay, and then stage 2 hypertension?
Is going to be the 140/90 or above.
Wow. Wow. Okay, then this is a game changer. And your final point has to do with your blood pressure medication. Tell us about that.
Correct. One of the big things about blood pressure medication, what you were saying, is that some people are concerned about it. There are a lot of low-cost generic blood pressure medications that patients can use and that they are very effective. So if someone is practicing the lifestyle changes and it's not lowering blood pressure, if someone comes into, whether it's a Minute Clinic or they're going in to see their primary care provider, there are blood pressure medications that are very affordable, and they can get on something to get that blood pressure down.
Right. So what brought about this change?
A lot of it has to do with just the patients in general, and overall we're seeing an increase in strokes.
Okay.
A lot of increases in some of these after effects of having high blood pressure for years.
Gotcha.
One of the things that we're trying to do at Minute Clinic this month, every Wednesday this month, including Valentine's Day, which is on a Wednesday,
okay,
we're offering free Know Your Numbers screening, so patients can come in and check their numbers, including their blood pressure,
gotcha,
and we're happy to do that.
Right, so people sitting at home today, if they have a doctor's appointment tomorrow, then they might be a little shocked that, hey, we're having some issues here. Your doctor may say that. So I guess that's in place right now.
Correct. That is in place right now. A lot of our primary care providers are starting patients on hypertension medication when they're hitting those elevated blood pressure levels, and especially at that 140/90.
Gotcha, gotcha. Well, thank you for joining us. For more information, just log on to WBTV.com and look in the Web Extra section right on the homepage. Thanks for being here. Everybody stay calm.
Keep it all calm.
Blood pressure.
Absolutely. Definitely, we want everybody calm.
Woosah. Thanks. We'll be back after this.